Hi, I'm Dr. Erik, and I wanted to show my potential patients and fellow colleagues how I use this super cool software called DTS Pro AI Smile Simulation Software. Um, first thing I'm going to do is click on Extra Oral Image. And it's super important that we take a good series of photos of Smile and Retracted, same exact ones we use for ExitCAD Smile Design and Smile Creator. And if you get a good image, it's just going to give you a killer AI face analysis. And it will save you a ton of time and help the lab give your patient phenomenal results if you take this one super important image. The other image in this software is optional. It's really for dental planning more so than for the smile simulation purposes. And then we're going to save our image. You can see it does a wonderful job right off the bat, marking that curve. I'm going to hit done because it's already dead on. I'm going to move this midline over a hair. Done. Image mapping, super duper critical that you don't make the mistake of marking the eyes. You want to mark the teeth here. And you pick two corresponding points. I'd like tip the one canine, top of the other canine, check fit. And we can adjust it if we want to by moving these lines up and down. We don't need to because we have good images right off the bat. So we're going to click done. Now, if you're my patient, I'm going to skip over the smile editing tool and I'm going to go straight to instant smile. And you can see what an amazing, outstanding job it did of just importing a really beautiful smile right onto someone's face. Um, and it's pretty true to life if as to what kind of results we're looking for. Because we've already pre-chosen our custom template, and we can obviously change all these different size teeth. I'm not going to because this is my favorite, it's my go-to, so we're going to leave it as is. But what I now like to show is a preview, which is super cool. Um, we can kind of overlay that before or after. But my favorite is to compare the two. And if we click the play button, it's going to show us a simulation of what we're doing in video. Now we can, of course, export this and send it to our patients, send it to the lab, and things like that. I mean, it's just amazing. Now, if I'm going to do an actual case and spend a little more time with some of the smile editing tools, and we're actually going to insert a case. Now, my favorite one is this triangular dynamic. To me, it gives me really nice proportions, but again, it's preference. Insert it, and you can see it kind of fits right over the teeth really, really well. But where this becomes important to a dentist is it's going to let us move the midline, make sure the gums are in a good position relative to the eyes, face, things like that. And sometimes what I do notice is if you lose track and you click one tooth by accident, it gets a little tricky to move. So if you hit Control A, it's going to reselect everything. And here you can resize to the patient's facial proportions and whatever proportions you like. Obviously, these are preset numbers, and when you're doing a smile design, you're going to choose what dimensions you're going to follow. And once we get to this point, you can see we can overlay that to the retractor. We can change the shape and things like that by clicking texture libraries. You can see it's going to let us make some changes here. And you can see we can change the texture a little bit. And if we want to move teeth, you would just go back to the last window Control A. And move them down a little bit, I think. There's short my last window. Click apply, and there we go. Now, a very important part I want to make sure I don't forget that you do is get whatever information you want to relay to the lab. Like our template, I like to include the proportions so you can kind of zoom in. The lab knows what kind of proportions you're looking for. You can put our guide to make sure you're happy with that. Smile curve if you want. You can export this retracted or smiling. I kind of like smiling a little bit better, but you can do both. Reference line is always good. You can use a Facebook obviously as well, but a lot of times the digital nowadays I'm finding is just as accurate as the Facebook, to be honest with you. With the exception of my temp scans, I definitely always like to give that Facebook. Don't always give the prep. And then we'll click export. Export templates with images. I'm going to save that. Template 2. Whatever you want to name it is fine. And then we're going to open it back up. And this is what the lab is going to see. Oh, this software is just astounding in my opinion. And again, that's the result we're shooting for. And if you look at our smile gallery, you'll see we had almost identical results to this because the patient said, I want a certain length of tooth, certain shape, certain translucency. And if you're digital planning this stuff properly, you can really deliver phenomenal results. So software is amazing. It's definitely worth getting. Clinical mastery students, if you guys are interested, they do have a great promo code. You can just email me or text me and I can give you that link. Thank you very much, and I hope this helps. Create some beautiful smiles.